For the purpose of the screening exam, we will test reflexes at the biceps, brachioradialis, triceps, patella, and Achilles. Reflex grading is done on a scale of 0 to 4+, 0 being absent, trace indicating slightly present only with reinforcement maneuvers, 1+ being present but depressed, 2+ being normal, 3+ being increased with possible spread or crossed adductors, and 4+ indicating clonus. The biceps reflex tests the musculocutaneous nerve as well as the roots of C5 and C6. Place the patient's arm in a resting position with a slight bend at the elbow. Place your index finger on the biceps tendon and swing hammer onto your finger while watching the biceps muscle. The brachioradialis reflex tests the radial nerve as well as the roots of C6 and C5. Place the arm in a resting position with a slight bend at the elbow, and then place your finger on the radial tuberosity or more distally over the brachioradialis tendon. Hit your index finger with the hammer and watch the brachioradialis. The triceps reflex tests the radial nerve as well as the root of C7. Draw the arm in such a way that the elbow comes to 90 degrees. You may place your finger over the tendon of the triceps or strike the tendon directly with the hammer while watching the tricep. The patella reflex tests the femoral nerve as well as the roots of L3 and L4. Position knee to approximately 90 degrees and then place index finger over tendon just below the patella or strike tendon directly while watching the quadriceps. The ankle reflex tests the tibial nerve as well as the roots of S1 and S2. Hold the patient's foot at 90 degrees with the medial malleolus facing the ceiling. The knee should be flexed and laying to the side. Strike the Achilles tendon directly and watch muscles of the calf. Alternatively, you may place your hand on the ball of the patient's foot with ankle at 90 degrees. Strike your hand and watch the calf muscle. While patient is seated, gently flex ankle to 90 degrees and strike Achilles tendon directly. If any reflex is unobtainable, reinforcement maneuvers may be used. Ask the patient to clench teeth for upper extremity reflexes, or clench fist or clasp hands in front of chest and pull for lower extremity reflexes.